We know that the FLT3 gets activated in many leukemias. In fact, the FLT3 is mutated in at least 30% of all leukemias, but we think it's even hyperactivated in much more than those. Targeting the FLT3 over the last several years shows that it does help. Patients could go to remission with just 1 pill a day, which is completely different from the standard chemotherapy that we used to give. Patients have to stay in the hospital for weeks where the mortality is high. With those pills, we can see dramatic responses within few days, great quality of life. But what we're also learning that these pills don't work for a long time. The median usually response duration is about 4 to 6 months to many different pills. So the big question is, if I have one drug, then we are in big trouble. But if we have several drugs available and we can just alternate and go from one pill to the other, this could change the landscape of treating acute leukemias. Yesterday in the leukemia oral session, we saw a very exciting new drug called crenolanib. And this is one of the new drugs. It's actually a type 1 FLT3 inhibitor, which is different from the other FLT3 inhibitors where all of them are type 2, which means they are very good in patients with ITD mutation, but they're not as good in patients with tyrosine kinase domain mutations or TKD mutations. In this drug called crenolanib, we saw responses even in these refractory patients. Now, we still see that the response is the highest if those patients never received a prior tyrosine kinase inhibitor, a FLT3. But even in the relapse refractory FLT3 inhibitors, we see responses. What was exciting to see in this study, that there were patients who got exposed to 4 different TKIs. I think, again, this could change the way that we treat acute leukemia from a very aggressive form to maybe a more chronic disease where we can treat it with several pills, pill each at a time.